So welcome to AMI's podcast. We're super excited here today. My name is Coleen Carberry, and this is Dr. Mike Carberry, my husband. And with us today, we have Dr. Arlan Fuhr from Activator International. So welcome, Dr. Arlan.
Thank you. It's good to be with you.
Yeah.
Good to be with you.
Yeah, it's super nice to have you on our podcast today. I know that you and I have had a couple conversations already, and like fairly long conversations to really get to know each other and understand each other's missions. And it's really pretty incredible how aligned we actually are in what we're trying to achieve.
Yeah, I was actually quite surprised because you are doing some of the things that we think is very important. And so it was fun to talk.
Mm-hmm. Yeah,
Yeah,
totally.
it was.
Yeah, totally. Yeah, AMI is as an integration company, you might not think that, the activator, right? What does that have to do with integration? Those dots don't even connect, right? But as we talked, and I know that as we talked with Mike, the passion I think that both companies have behind it of wanting to actually help and to actually handle people in the what we would consider the pain space. That alignment is so incredibly strong that it makes sense that for us, the actual activator device and the activator treatment method inside the integrated model is like it's a beautiful blend in treatment.
Well,
So
it works together.
Yeah, it does.
Yeah.
When I went to school, I started school in 1987, and we were being exposed to different techniques, and the activator was brought up, and the activator was something that they showed us ways that you can use this to be safer for certain patients, and that made perfect sense to me. I don't think I've ever had a clinic that didn't have an activator in it, and it was more than just a safe adjustment for certain patients. It actually could do adjustments that you couldn't really do by hand. And there was a video I saw years ago. I talked to you about this when we met in California. And it was an X-ray video fluoroscopy in slow motion. And it showed the activator hitting C1 and C1 moving into place. And when I saw that, I'm like, oh, wow, this actually really does work. And I've been sold on it ever since. So is that video still around?
Yes, and that was one of our first research projects. And because it was the Atlas, of course, all the upper cervical people were thrilled to death because they had not had any data. And, I have a saying that data always wins. And Activator started out, I moved to Phoenix, Arizona in 1988, and we had 2 papers. And I went to Arizona State University into their biomechanics department. And Jack Winters was the head of it at the time, and it was brand new. And I took both of my papers into him. And I said, what do you think? And he said, your research is a bit immature. That meant I didn't have much. But he said, I like your ideas. Now, fast forward 30 years, we now have over 170 peer-reviewed papers and 27 clinical trials. And that's why my statement, data always wins, is really important to the patient. And that's what Activator is all about.
So I'm realizing right now that when I first heard about Activator, it was brand new. So you started in 88?
Well, no, actually, we discovered it in 67. And then I spent 20 years in practice in a little town in southern Minnesota of about 4,000 people. And we built a practice to 1,000 patients a week. And so everybody then began to notice it. And so that's how we weren't even thinking of seminars. Then we had some people come to our office and wanted to know what we were doing. And so that was our first seminar. We had 5 people in the basement of our clinic. And from there, Jim Parker found out about it. And he asked me to become a speaker at Parker. And that's when it kind of went national.
I got it. Yeah. So when I was in life, I started in late 87 and I graduated in 91. But when it was presented to us, it was presented like, this is the thing you use. Like I thought it had been around for a long time. And apparently it has been around for a long time.
Yeah, it's about 60 years old now.
Good.
Yeah.
So tell us about the mission of Activator method.
Well, the mission is to get the highest quality, standardized care to the patient. And I don't think I have to tell you, Mike, that you walk into a doctor's office in, for example, North Carolina, you're probably going to get something totally different than when you walk into an office in New York City.
Yep.
So we said that we've got to standardize this whole thing so a patient can go from office to office and get the same kind of care. It was a bigger project than I realized. And so for 15 years now, we have been working on a project called Find a Doc. And we now have over 1,000 people that are proficiency rated in activator methods. In other words, standardizing their care. So let's say you're in New York City, you get hurt. And so all you got to do is go on to activator.com, find a doctor, and it will find somebody right in the heart of New York City for you to go to. Believe me, that's a big deal.
Yeah.
Now, there's only one problem we're having right now is we're running short of doctors. So when I met you guys, I thought, oh boy, here we can add some doctors because patients are looking. And I don't know if I told you this, but last month we sent some 17,000 patients to our proficiency rated doctors.
Wow.
That's phenomenal.
That is
That is phenomenal. You know, it's kind of amazing, even the synergies of the mission, because, you know, for AMI, you know, AMI's mission is to be able to put an AMI office on the ground across the United States. So anybody who wakes up in pain actually has an AMI office within reach to turn to for healthcare. Because, you know, somebody every day wakes up in pain, anew in pain, and somebody every day is being handed a prescription to handle their pain. Every day that's happening. And so our mission, just like your mission, is to have doctors across the United States who are proficiency rated, right? So that they can get standard of care. Ours is the same, is to be able to put a solution for pain care that does not have a prescription attached to it and is not where you have to go to surgery and have your spine fused, right? But to actually handle your problem and get back to your life. And how great is that to be able to have a proficiency rated doctor within there that also has the standard of care with chiropractic? Because there's, you know, there's other services offered in the integrated practice that do have standards of care in them. You know what I mean? So to be able to actually have the standard of care of chiropractic, that's phenomenal. Yeah.
Yeah, you know, one of the things we're trying to accomplish with AMI is to standardize care. We know we have a program that works as long as it's being duplicated. And the trick is, we know we're all doctors and we have our own practices, and people get used to one doctor and they don't want to have another doctor because there is no standardization there. If you were able to introduce standardization into the adjustment, then it wouldn't be a big deal if the doctor went on vacation and somebody was covering for him, because the treatment would be the same. And we're very big believers in that. My background is in marketing, and I worked for a couple of Fortune 500 companies before I got injured and actually changed my career. But I can see that to be successful, you have to step out of that personality-based mentality and step into a standardized mentality or a system-based mentality. It sounds like you and I share the same thoughts on that.
100%. And when Coleen and I were talking the other day, you know, she mentioned the fact, and I think you're going to talk about it, but this patient that came in and they were happy to come to the medical clinic, but they didn't really want to get their neck cracked, if you will. Well, I don't know if you know this, but about 90% of people, I think you say 89, but 90% of people don't want to go to a chiropractor because they don't want their neck cracked. So that's why Activator fits so well to, you know, AMI, because they're not going to get their neck cracked, and it's totally non-force and something that they won't have any regret of having done to them, so to speak.
Yeah,
Right.
but you know, interesting is, you're right, Arlan, we talked the other day and we were talking about when Mike and I started practice a long time ago, practicing together. What we did was we had a very large chiropractic practice. So we're seeing 750 visits a week and then some. And we just thought, hey, we're really making a difference. So we actually had some survey work done because we were thinking about integrating. And we sent out surveyors into our public and we said, you know, the question was, what do you think of a medical doctor that works for a chiropractor? And hands down, the surveys came back, must be a pretty desperate medical doctor to have to work for a chiropractor. And we were really taken aback because we had a really big practice. So we waited a week and sent the surveyors out again. And that question was, what do you think about a chiropractor that works for a medical doctor? And they said, it's got to be the best chiropractor in town if a medical doctor picks them. And that was when, with Mike's marketing background, to realize fighting against what the public thinks is a very long road to being able to change something. And it dawned on us, if we can actually create a medical practice that does not prescribe drugs, that does not use cortisone, does not use do surgery like using spines and things like that, we can create a paradigm that people can come into and be introduced to chiropractic care for the first time in their life. Wow, we could actually not only change healthcare, we could get chiropractic out to 100% of the population, because 90% of the population will come into a medical office. They told us that through surveys. They'll come in and then they're introduced to a chiropractor. And you're right about that, Arlan. Last week, there was a patient that basically said, I'll do everything, but I don't want that chiropractic. I don't want my neck cracked, right? And so the chiropractor came in and sat down and had a lovely conversation with her, and she brought the activator in. And she said, put your hand out. And then she did the activator, and she said, I'm going to use this instrument to adjust you. And she looked at her hand, and she looked at the instrument and said, I can take that type of chiropractic. And so here, this is the exact, our mission is to actually introduce chiropractic to 100% of the population. This is where the dovetailing of the activator method into the integrated model is absolutely beautiful to do that.
Yeah. As a marketer, you look at products that are successful. I'll just take Starbucks for an example. Some people like Starbucks, some people don't like Starbucks. But if you like Starbucks, you would look for that consistency. No matter what city you're in, if you go into a Starbucks, you want that coffee to be the same strength that it was at the last Starbucks you're at. And if you went into one and it was weaker or stronger, it would just ruin your whole image of Starbucks. And the same thing is true with almost everything. And in standardizing care, obviously we can't make everybody's adjustment exactly the same, but with an instrument that's standardized the way you treat that patient, and makes it similar from doctor to doctor, and it gets results because we know it does work, is what I think is going to be a great tool for our profession to use to get acceptance across the board from the 90% who don't want to go to a chiropractor.
Mm-hmm.
Well,
So,
I also have some very great news for you. I know that you have some 800 doctors in your group, and I don't know what percent are proficiency rated, but we have now been able to do this digitally. In other words, the doctor doesn't have to go to a seminar. They don't have to leave their town. They don't have to spend a ton of money to become proficiency rated. And so what they do essentially is they take the digital part of the activator basic scan protocol, and that gets them up to speed on how you do a basic scan on a patient. And then we also invented a way to do the practical exam even, and that is the CA just simply takes an iPhone and holds it, and we send them a set of questions, and then the doctor goes through the question set, and the CA just films them, and then they send it in to us. And we have one of our doctors look at the film, and if they're good, they get rated. If they're not, we find out where they're having trouble and help them with that problem. So they never have to leave the office to become proficiency rated. And here's the other good thing. If they've been proficiency rated, sometimes doctors got proficiency rated and then they changed, offices or something. They didn't continue. If they were proficiency rated once, they don't have to even take the basic exam, the practical. They can just take the digital exam, and it's a whopping $399. I mean, it's really not very much. And so they can become proficiency rated. And if you've got several doctors in an office, then they all take it, each one takes it separately, and they're all then proficiency rated. And it makes the office have a very good standardization in the chiropractic program.
Yeah, and it takes us to the concept of getting the 90% who don't get chiropractic care. It would be easier for them to get it if it was a proficiency rating on a standardized type of treatment. And I think that's brilliant for our profession and brilliant for the country.
Yeah, totally. Yeah, because with the AMI model of being able to, our doctors, the majority of them are chiropractors to start, and that what they've opted to do is to medically integrate, to not just expand their services, but to access more people in their community. That's probably the biggest reason why AMI doctors integrate, is because they recognize the fact that they're not accessing enough people in their community to help. And so the idea of bringing on a medical team and putting a team of healthcare providers together, because that's what AMI teaches our doctors to do, put a group of healthcare providers together. It could be a physical therapist, chiropractor, medical person. We have some acupuncturists, but you put a health team together. The patients come in, and it's almost like a one-stop shop. The convenience of coming in, having a full workup, and then whatever services that you need is all under one roof. And that chiropractic piece, what we kind of always say is, without the chiropractic piece, we're just another paradigm in the medical model. Like literally, it's that chiropractic piece that makes it. And when you do get somebody who's never been adjusted before, what you don't want to happen is have them say after 2 adjustments, I don't want to be adjusted anymore. Because we know that it's the chiropractic adjustment that is actually the core of what's changing their health, is putting back the mobility in their spine. And that's why our model is so phenomenal. And then having the activator method, which is then going to pretty much know that 90% of the population walking in the door will be embracive of chiropractic care.
I think you guys will agree with me on another thing. There was an old saying that used to, in chiropractic, 20% of the doctors are successful. The others just flounder out there. And so my goal in all of this is to take that 80% that, they came out of school, they were sharp at school, they were good chiropractors, but they had no way they just didn't know how to do business. And I think this is another important thing here for the kids coming out of school, that they tie into something that has the business acumen already established for them. And that's what you're doing. And so I think this is another saving grace to that kid that comes out of school with $250,000 of debt, and he has to try to go out and make it. And so immediately they could go into a practice, or they could be associated with a practice or start one, that they had this kind of help. And I'm sure you take new graduates under your wing.
Absolutely.
Yeah.
We sometimes say that you go, these guys go to chiropractic school for 4 years. They get a phenomenal education as a clinician and as a chiropractor. And you're right, nothing in business. AMI gives them the business portion of it to be able to be successful in business. Because you're right about that. They can spend up to $250,000 in student debt and not get that piece of the education, which is sorely needed in order for them to be successful.
I know that a number of our doctors would be interested in getting that proficiency especially for associates, to standardize at least one method of adjustment amongst their patients. And you mentioned the cost of it and what they have to do. How long does it usually take a doctor to complete that proficiency?
Well, it's not a long process. They have to have 12 hours to cover the basic scan protocol. And so they can sit down over a weekend and they can complete the 12 hours. And it's really what we built it. Craig Little is the head of CCE, and he lived here in Phoenix. So he guided me through a lot of this. So we have competency-based learning built in. We have time clocks on it. It's the way it should be done postgraduate wise. And they can do this like in a weekend, like I say, and they could take the course and go through it. And then the next week they could have if they hadn't had it before, they can then have a camera taking a picture of them and sending it to us. So within a week, they could become proficiency rated. It's a really nice type of project, and it's something they can do without a lot of hassle.
Yeah, having that proficiency rating would definitely be an advantage in our clinics. So do they get CE credits for doing that course or no?
Absolutely. Yeah, they will receive 12 CE credits also, which, I mean, this is really a good deal. Number one, they'll get proficiency rated for your operation. Number two, they get 12 hours of CE, so they don't have to run to some course, and it's all for the same price. So there's a lot. And our goal is we need doctors out there because, like I said, I have to tell you a story. We had the Super Bowl here in Phoenix, and we had the Waste Management Open. That's the Phoenix Open. Two big things. Adam, our PR guy, said, let's get a billboard. And so he found a way to get one of those electronic billboards, one of those big things out by the stadium. And we put that up out there. And during that week, one of our doctors had 350 calls from the billboard to come in to him because he's on the proficiency rated list. Just one doctor.
Wow.
And then other ones were even getting more. And so, but I mean, there's a lot of people in town, and they're activator patients. And so they get hurt doing this and doing that. And so they want to know, where do I go in Phoenix? And they could look right on the billboard, and there they went. So it was quite a project.
Yeah, they would actually be able to do that, following that proficiency directory or line. They could be in another city, not their hometown.
Yes.
Go get an adjustment if they needed it, which is phenomenal.
Yeah.
That's really awesome. Okay. So tell me about how your program works as far as when people are interested in Activator, how they find you.
Well, they can just go to activator.com, and it's very simple, and they can sign up, and it's got another button that you hit for virtual training. And then that takes them to the virtual training page. And by the way, our virtual training, we now have over 70 hours of virtual training. But for the new doctors that are coming in, the big thing is to get into the basic scan protocol. So they learn basic activators so they can take care of that new patient that walks into your clinics. And then there's upper extremity, lower extremity. There's all different types of things that they can continue learning. And so each year, instead of going through basic scan protocol again the next year, they may want to look at shoulders so they can have upper extremities. Next year, they might want to look at feet and knees, so they go to lower extremity. So, and we even added animals this year. So we're, because mainly because I wanted to adjust my little miniature schnauzers, and I didn't know what I was doing. And so we have a young lady that's teaching animal chiropractic adjusting, and everybody, she was at Logan at their symposium, and she had 400 of the 500 attendees there in her class. So I guess that shows you there's a little interest in adjusting animals.
Yeah, that's phenomenal. I didn't know that about you, Arlan, that you had veterinary chiropractic on there. That's
yes,
phenomenal.
It just came out, and it's approved by probably almost 40 states now. So everybody's we're always in Activator. We like to be out ahead of things, and we know now that with the postgraduate education, they're going to require what we're doing right now. And so we like to be ahead. And people ask, how have you guys been successful for 57 years? Well, number one, next door to us today, they're doing a ISO certification. And there's, I don't know of another instrument that's ISO certified, which means in case you get in a lawsuit or something like that, you can show that you are FDA approved, ISO certified. And that's the kind of thing that we need to make our profession stand up against, anything that comes against it. So I think that's important that we follow the rules.
Yeah.
Yeah.
So then the proficiency course is focusing on the spine, but then there's more advanced courses for extremities as well.
Yes, but the basic scan protocol, let's say your 800 doctors all want to become proficiency rated as soon as possible. That looks at the feet and knees, the pelvis, the thoracics, the lumbars, and up to the cervicals. It does all, and even a basic shoulder test. So they don't have to take 3 different modules. They can take that basic scan protocol, and they're fine. That will take them through 90% of the people that walk through the door.
Right.
Well, that's phenomenal because, in the AMI offices, when you actually access 100% of the population, you're getting knee patients, you're getting shoulder patients, and granted, as a chiropractor, understanding, I'm not a chiropractor, but I know we talk about this, that the spine, everything comes from the spine. You know what I mean? It affects everything in the body. So in our offices, we're always looking for what would be considered the other orthopedic contributing factors to their problem. But they do come in with ankle problems, knee problems, shoulder problems. So that's great that your proficiency testing or scoring will actually teach them how to use the activator for extremities as well as spine.
Yeah, we do a lot of, like we have on a regular basis, people who want to avoid a knee replacement surgery coming into our offices. And we do really well with them, but it would be better to have the ability to use this instrument on the extremities as well. I could just see a lot of application in our model with your device. And it really is amazing. And it's a perfect match, I think. So
I have to tell you.
Go ahead.
I just want to add something. You said knee replacement. I have to tell you a story quick. My wife had her knee replaced 5 years ago, and it went fine. Everything was good. But she started having pain in the knee about 3 years later. And as I was analyzing her, she had a pelvic bone that went out. And so I corrected her pubic bone, and the knee pain went away. And what I'm saying is when people have different kinds of surgery where they put implants in and things like that, it changes the body's balance. And so you need to look at the whole body and then go find where the problem's coming from. So as a physical therapist, we had a great physical therapist. I mean, she was just the best in the world. And I told her about this afterwards. She said, I think we need to add chiropractors to the physical therapy group because we didn't know about this. And so that, Colleen's why integration is so important.
Yeah.
Well, you'd be glad to hear, Arlan, that we actually have some physical therapists that are clients that are hiring chiropractors and bringing them into the medical clinic. And we just got off a conference call with a couple of them just a little while ago.
Yeah. And medical doctors, we have clients who are medical doctors that have embraced the model and are bringing chiropractors in to work with them. So that is the future of medicine, is that collaboration of the team.
Well, and then the other thing that I just saw the other day was that after 2030, half the country is going to be over the age of 65. So the geriatric practice is going to be huge. And one of the things that we are majoring on right now is the geriatric practice. And we just came back from doing our shooting for the year, and we did a whole thing on geriatrics and how to take care of the geriatric patient. There's two big things right now in chiropractic: pediatrics and geriatrics. And those are the bat and sports injury. Those are the ones that are everybody's, making all the noise about, so to speak.
Yeah. Yeah. And your model does fit in perfectly with that.
Yeah.
So if people want to find out more about your program and how they get a hold of you, how can they get a hold of you?
Well, again, I'm going to say the best way is just go to activator.com. And there's our webpage, which we just redid, and it's very easy to navigate. They use me as the navigator. If I can navigate it, anybody can. And it's one of those real simple pages. And then you just go to virtual training on the webpage, and you go to that, and they'll take you right to all the different programs on virtual training. And I think your group, by seeing this podcast, are going to be made aware of how valuable it is to have a light force technique in their, so to speak, their technique bag. And once they start using it, I think they're going to see, wow, why am I doing something else when I can do it this easy? The other thing it does for doctors is it extends their practice life. I am old, so to speak, and I haven't got one joint bad, one thing. And I can tell you many people, colleagues that were different types of techniques, they have inguinal hernias, they have knee replacements, they have shoulders, all the different things. So it extends the practice life of the doctor, which I think is a very important thing to that practitioner that wants to continue on. Like, I like what I do.
Yeah.
Yeah, that is true. That is very true.
I did a lot of manual adjusting earlier on in my career, and I've had 2 shoulder surgeries to prove it. And it does take a pounding on your body. And the thing I like about your instrument is the proof is there. It does work, but it does save a lot of stress on the patient and on the doctor, which is a win-win. Okay.
Yeah.
All right, Arlan. So I want to give you, our listeners, your listeners, a link that they can reach out to us if they're interested to learn more about AMI. And it's amidoctors.com/activator. So they can actually get to this sequence and this information by going to that, and they can browse around the amidoctors.com website, and then they can hear more about this program and your program as well. And it's really good to be connected with you, and it's really good to align our purposes because they're very similar. Both of us want to standardize healthcare and want to standardize physical medicine, and I think together we can do a lot more good than we can apart. And one of the things I've been saying lately, I just spoke at the Michigan event. I did 4 hours continuing ed there, and I ended by saying this post-COVID world needs more chiropractic, not less. And I'm glad to align with somebody like you to help deliver that to our communities.
Yeah.
Thank you very much. And we feel the same way because our missions are running side by side. So I want to help all those 800 doctors become proficiency rated so they can not have that patient that comes in as a medical patient have any adverse results or any side effects from anything that they can say, wow, those chiropractors are better than I thought.
Yeah, absolutely.
Yeah, totally.
All right.
Yeah.
Great seeing you. Great spending time with you, Coleen.
Yeah. Wonderful spending some more time with you, Arlan. It was a pleasure.
And hopefully we'll see you.
Thank you much, guys.
Yeah. We'll see
Yes.
you soon. Okay. Bye.
Bye.
Bye-bye.